The new country stars first. 99.9 KFAV, Warrenton, St. Charles, Winfield, and in Washington at 105.1 FM.
All right, then it is 51 degrees in the Westplex. We continue at 8:02, and we have on the line with us Dr. John McAllister, and we're going to talk about bone and joint issues here this morning, and he's a specialist in that area with advanced bone and joint. Good morning, sir.
Good morning, Mike.
Doctor, let's first off explain a little bit about the practice that you guys have. Tell us a little about the company, if you would, please, and then we'll get into orthopedics and things.
Well, we've been in St. Charles County for 35 years. We provide comprehensive musculoskeletal care. Basically, I'd like to say everything from head to toe, but honestly, we do basically neck to toe. So we take care of problems with the neck, spine, shoulders, elbows, wrists, hands, hips, knees, ankles, feet. We take care of any sports problems. We have spine doctors. We have both pain management and a spine surgeon. We can do pain in muscles, joints, anything in the upper or lower extremities. We even have podiatry here.
Okay, now, so when we talk about orthopedics, and I know you have, as you just mentioned, specialists. What is your subspecialty when it comes to orthopedics?
Well, I take care of primarily knee and hip problems. We have doctors that specialize in shoulders, and then I do knees and hips. We have some general orthopedic practitioners that just will take care of basically anything you could think of that has to do with the bone and joints.
Mm-hmm. It's interesting. You talk about knee and hip issues, and I don't think we all realize the interconnectivity of our bones and joints. It's amazing how you can be. It can hurt, and just the entire body can ache because of one small area.
That's true. There's a lot of times pain will refer or radiate from a specific joint down a bone. That's quite common.
What are some of the more common things that you see when it comes to the specialty area that you're in?
Well, with knee problems, there's always in the younger people a lot of sports injuries. So anterior cruciate ligament injuries, things that sometimes the runners get. Anybody that plays soccer or football is unfortunately at a high risk for knee injuries. Mm-hmm. As we get older, a lot of the injuries are more degenerative, so we see meniscus tears that happen as people age a bit that can start to cause popping or catching in the knee, sometimes kneecap problems that hurt. Some of that comes as our population has gained a little weight over the years, so we see a little more of that. And then we have quite a bit of problems with arthritis, both hip and knee. Osteoarthritis, where we're all getting older and living longer, and so we get a lot of degenerative problems of our joints.
As we head into this warmer weather, we're looking at a nice spring day today, and springtime is here. I'm going to assume, based on what you just said about, let's face it, we all tend to pudge up a little bit during the wintertime. It's a good idea to protect our knees and everything else and kind of slowly work our way into a regimen for spring and summer.
That's right. If you go too fast, sometimes stress fractures can occur. But I think we all like to try to slim down a little bit for the summer, lighter clothing, I suppose. And so, what we can do to protect our joints is avoid real high-impact activities and do our best to keep our weight down. Our knees, in particular, see about 5 times our body weight in forces, and so they are one of the first joints to kind of complain when we gain a little too much weight.
I find it amazing in your area of practice, the advances that have been made, too, with technology. And because I can remember even, 20, 30 years ago, you talked about knee or hip. You're talking about some major surgery and major downtime. In some cases now, especially in the knee, you can get them in and get them out the same day.
That's correct. We're doing some outpatient surgery on knees and also for even joint replacements. And we can do that with hips, too. We have some, myself and one of my partners, Dr. Glick, have been doing a direct anterior approach to hip replacement for over a year now, about a year and a half. And that is remarkable how fast people recover. Through a very small incision, usually about 3 inches long, we can put a new hip in.
So what's the first step if folks are having some issues? How do they go about, do they have to go to their first, their regular doctor first and be referred, or can they call you directly? How does that all work?
Sure. We can be reached directly. There's a few insurance plans that require a specialist, a referral to a specialist, but most people can just call us directly. We have 2 locations. One is on Highway K, right by Highway 64 or 40. And then we have one in Piper Hill, which is actually real close to the Recplex off Mexico Road. Our phone number is 636-441-3444. We also have something called Quick Care, where if somebody has a new injury, we can see them in the St. Peter's office from 9 a.m. to 4:30 without an appointment.
And now I guess if folks, do you guys have a website, anything like that?
You bet. It's advancedboneandjoint.com. It's all one word and lowercase. advancedboneandjoint.com.
Very good. Well, I know you guys do great work. I've talked to people that have been there. We've talked to some of your other physicians down there, as a matter of fact, and I just think it's great that again the advances that are going on. There were times when people were thinking, this is it. I'm going to be completely stoved up for the rest of my life. But you can certainly get them back on the right track, and that's good to see.
We sure try. Try to keep everybody going.
All right, Dr. McAllister. Hey, thanks for checking in this morning, and good luck.
All right, thank you, Mike.
All right, thank you. Dr. John McAllister, Advanced Bone and Joint Surgery, with us this morning. And again, you can contact them, go to their website, give them a call, and get yourself, if you're having issues with your knees, your hips, or anything involving bone or joints, that's where you want to start. They have the experts down there. 51 degrees in the West.